What Mental Health Colorado is doing to change the culture around mental health is, first of all, cultivating greater public awareness of the extent to which mental health is part of all of our lives. It is a key part of all of our lives from start to finish. To that end, what we're doing is we're spreading a greater understanding of the key intervention points that yield greater health of mind across the lifespan, beginning with a strong start for all children and the kinds of things that need to be in place to cultivate healthy human development in children. And continuing on with other essential factors that lead to health of mind, like access to housing, supports and services that keep us well and are essential as we're all trying to survive on a challenging and hostile planet. Other things that we're interested in keeping a keen eye on are decriminalizing mental health and shifting this nation away from a nation that has grown comfortable in relying upon law enforcement and corrections interventions to manage mental health in the absence of a robust system of care that would support people effectively from start to finish. And then we're also very much interested in wellness and aging and understanding that while the physical deterioration of our bodies is inevitable over the course of our lives as we age, our mental deterioration is not necessarily inevitable. And in fact, that as our bodies are giving up on us, it's our highest aspiration to retain soundness of mind in our final moments. And that's what we're after, is a system and a community that lend to those things. And some of the work that we're doing to achieve that kind of culture change are the important communications and advocacy work in raising that public awareness, raising that awareness amongst state leadership and elected officials. We have a brainwave network of grassroots advocates from all over the state of Colorado who are people who have lived experience of needing mental health care and successfully or unsuccessfully finding that care. These folks, we are their voice for policy and practice change in the state. We listen attentively to the consumers, our consumer partners, and we bring them into action when it comes to doing outreach in the context of the legislative session or in reaching out to their local officials to make change happen. We do a great deal of policy work along that whole lifespan continuum of intervention, from policy work in providing a stronger start for all children, making sure that teachers are better prepared to recognize mental health needs of the kids that they're working with and know better how to refer them to effective services. We do policy work again in decriminalizing mental health and making sure that people with mental health conditions are not discriminated against. We shouldn't be using jails as our holding cells for people in the absence of appropriate healthcare facilities to support them.